Let's first talk about what's happening in Maharashtra and whether there is truly any plan to unlock or ease up restrictions. A statement made by a minister in the state government caused a flurry because he was asked a question on unlock and said a plan was indeed under consideration. Meanwhile, let me just tell you what the latest numbers are in Maharashtra. Maharashtra has recorded 15,229 new infections, 307 deaths and 25,617 recoveries. The recovery rate in the state is now close to 95%. Let me go across to Utkarsh Chaturvedi. Utkarsh, a lot of confusion this evening because you have a state minister saying that we are planning to ease restrictions. Then you have the chief minister's office coming and saying that no, there's no such plan right now. But there is nothing official. There's no official notification. So what is going on? What are you learning?
Exactly. In fact, as you said in the beginning, this was not. This was less of an announcement and more of a question which was posed to the minister while he was speaking on some other topic. And that is when the question was posed to him and he said that we are considering that. Unfortunately, what happened was that this was picked up as a government announcement. And then the Maharashtra CM office had to really kick in. You don't really see this with the CM office, but within, I think, 30 to 40 minutes, there was a clarification which came in that the point which the minister has spoken about is under consideration, but it will only be implemented after due diligence has been done, and there will be an official notification telling the same. This is not the official announcement, and it should not be taken as what the government stance is. Now, this anyhow happens a bit more in the Maharashtra government, given the fact that it's a coalition government with many ministers really and three parties working in tandem. But what happened here is that there is a plan which is in work. And if you look at it, it's not only the level 5 plan. If you look at the last guidelines as well, there has been demarcation based on oxygen beds and on the basis of positivity rate. So it's been done in 2 parts at this point of time, but they're moving it to 5 parts. What I've been told when I've spoken to the ministers in the government, what they're telling me and the sources are telling me is that it's going to really move from level 1, will have the least amount of restrictions in place, but it will not be that the level 1 will be open with everything and there will be no restrictions as what the minister really spoken about. But and it will get stricter by every level, and level 5 will be what it is right now. The only non-essentials will be allowed in those areas. So that's the plan right now. But by when can we notify? What we have been told at this point of time, especially Mumbai, because the current notification will go till 15th of June. What we have been told that Mumbai at least will continue to be in the current phase of unlock, which we are seeing till 15th of June. So it might be that the next meeting of cabinet, which happens every Tuesday, you might get a sense what's going to happen there. And it's the next fortnight, 15 June to 30th June or thereafter, is when this policy can come into place. But as I said, there's nothing final yet. Due diligence is on.
So it's under consideration, right? Yes, of course. Thank you so much for that, Utkarsh. Thank you so much for those details. So basically, it's under consideration right now, but it's an important story to watch. You know why? For the simple reason that cases have come down quite significantly from its highs in Maharashtra. Over 60,000 a day was what we were seeing, is down to around 15,000 a day. Major cities like Mumbai have had a positivity rate below 5% for several days now, and other parts of the state as well. And that is a similar situation all over the country. So as various governments decide how to unlock, will a graded plan really help? That's what we're discussing this evening. Dr. Om Srivastava, member of the COVID-19 task force in Maharashtra, with us this evening. So is Dr. Rahul Pandit. He's also a member of the Maharashtra COVID-19 task force, and Niranjan Hiranandani, co-founder and MD of Hiranandani Group of companies, also on the show to speak about the economic aspect of a possible unlock. Welcome to all of you. Dr. Om Srivastava, great to speak to you on the show. I want to know from you whether we will be seeing more caution this time around, considering that Maharashtra was the first state to be hit by the beginnings of a second wave. The second wave has been devastating in most parts of the country, and we will all be once bitten, twice shy. So what are the parameters which should be seen for easing of restrictions so that we ensure there is no third wave which comes because of an easing of restrictions?
So first up, thank you for having me on your show. For sure, there's going to be the once bitten, twice shy story, considering the numbers that we saw in the first wave of the pandemic. there is just no way that there is going to be any amount of complacency, especially since we've also seen it's not just the numbers, but also the kind of pressure that the state has had on the beds, on the medical services, both in the public and the private health spaces, and just about everything concerned with delivery of healthcare systems in the state of Maharashtra, not just in cities like Mumbai, but also in the interiors of Maharashtra. So yes, there is going to be an abundant amount of caution. What is going to be needed? Well, we are probably going to be having to keep an eye on the numbers once the lockdown starts. So the easiest part is non-essential services, as I'm sure you're aware. That will probably end up starting first. But then the essential services and the more graded services that will open up gradually as time goes on. And what is the impact that that's going to have on the numbers that we are going to see, the total amount of surveillance in the public health system that will have to be even more robust as compared to the last time. And what are the numbers of not just adults, but also children who are going to require medical attention, and for how long, in what space will they need to be hospitalized? All of these will come into the making of policy as to how well you are going to be following these figures and making policy. That will all have a role to play. So I think it's going to be an interesting set of times here onwards for the next maybe a couple of months, maybe even longer than that. But that will dictate what kind of policies will come into the state of Maharashtra.
You know, Dr. Rahul Pandit, things like or services like restaurants, spas, salons, gyms, do you think there is a scope for opening up? Today we heard from West Bengal Chief Minister Mamata Banerjee, who's allowing restaurants in West Bengal to open between 5 to 8 and wants to vaccinate everyone who's working there. Are these some of the options that we can look at that link the easing of restrictions to the level of vaccination in that sector or in that space?
So good evening, Tamanna, and good evening, my co-panelists. Look, I think we need to be a little bit, we are jumping the gun. We are still having 15,000 cases in the state, and we are still around 900 cases odd in Mumbai as well. But test positivity rate may have come down to below 5%, but corona has not gone away. It is still very much there. Yes, it is getting better as days go by. And we know that while we may want to ramp up the vaccination drive, the vaccines have not really been available in the numbers what we would want them to be available. And unlocking, which will happen, will definitely happen with a lot of caution. And it has to happen with a lot of caution, as Dr. Om Srivastava so nicely alluded to it, that we cannot be now complacent about it. And the policy will have to go hand in hand with the IEC about masking, the protection of the children, and all of these things. Yes, there may be a policy which they may look at a particular business or a particular sector of the industry where they may want to unlock first and then they might want to go ahead second. But those are the plans and policies which the government will put up. Vaccination, it would be obviously beautiful to have vaccination for all the people who are involved in an industry which involves interacting with people. So yes, restaurants, salons would be one of them. But the fact is that right now we don't have the amount of vaccines available there. Secondly, we will also have to look at the test positivity rate, the amount of oxygen beds available in that city, the amount of free ICU beds available in that city. Those things which actually make us help come to a number whether we can actually ease the policies or not.
Niranjan Hiranandani, I want to respond on two facets. One is on the hospital level, because you run a hospital as well. Are you truly seeing enough reduction in demand for ICU beds for COVID care? And secondly, from the perspective of industry, do you think that especially service sector can hold out for several months longer as we open up with caution?
The good news, Tamanna, is the fact that today I can give you beds in my hospital if somebody needs it. And that is something which has completely changed in the last two and a half weeks. earlier, if somebody asked for a bed, it was quite difficult to get one. So I think that's a positive story as far as Mumbai and Maharashtra is concerned. So there is a significant improvement. The question is now about the economic part of it, as you have correctly put up and flagged off, as compared to the fact that we need to keep a lockdown in order that the spread of this should not happen. But the real fact is that we cannot close it down in perpetuity, and we cannot keep every business closed down for a longer period of time. So I think personally that Honorable Chief Minister has done a fantastic job of being a conservative person in terms of seeing that there is a calibrated opening up. And this calibrated opening up will continue depending on what the numbers are and how many hospital beds and oxygen and other things are available. So if the situation goes worse, it'll definitely be a lockdown situation, which will be strong. And I don't know about the levels, but certainly calibrated opening is bound to take place. You can't close down. There are millions of people who are out of jobs, suffering tremendously to do. And at the same time, we can't have the situation where the healthcare system was breaking down and we didn't have adequate number of beds, /oxygen, /medicine and other things. But the situation is that we are now talking about, because of lack of vaccination coming up sufficiently enough in the short period of time, we are going to definitely look at a possibility of a third wave. So our hospitals are prepared for the third wave. Sadly, we are also looking at the fact that whether we will get oxygen or not, we're looking at the fact that the medicine should be available. All the other things are being readied both in the private and the public sector, and they are quite efficient to do so. But I can assure you that there has to be a calibrated opening up. If the numbers are the way they are today, or they start moving down a little bit more, we should be opening out, because this thing can carry on for a year or two until we don't get the whole country vaccinated, or at least 60-75% of the people vaccinated. The answer is yes. They will be opening out, whether the rumors are there or not. You may not see it on 15th, you may see it on 21st, but some opening out is bound to take place in this short period of time as the numbers are going down.
Do you agree with that, Dr. Srivastava? What is the sense? Yes. Dr. Srivastava, what is the sense you get from discussions within the task force? I'm sure all of you experts are being asked for your point of view. Dr. Rahul Pandit just said that, even 15,000 cases are not good enough. What is really that threshold which will make it tolerable to open up, and to what extent?
So you'll have to find a balance. You cannot simply say that because of the numbers, I'm not going to be part of the process that will allow people to get back to working. There is the common man, there is the daily wage worker, there is the salaried individual, for whom we've got to be cognizant of the fact that you cannot take away his livelihood simply because our infrastructure for health is nowhere close to being what it should be. We are aware of that. Yes, we probably should have learned from something that happened in the last year and a bit in our lives. But we cannot simply say, look, please don't work for another year's time, because we don't have the infrastructure with us ready. So it'll have to be a balance. There's going to be voices of dissent, and there will be people who will probably want to have one way or the other put down emphatically, but it'll have to be some kind of a halfway measure where everybody's interests are best looked after. So I think that any policy from here will require that all the stakeholders are accommodated, and that the best interest of the daily wages workers, or the person who is at the lowest rung of the salaried structure, is accommodated in as far as possible in the same way that the best interest of the state is accommodated as well, so that there are not glaring figures of people who are being hospitalized only because you've had a lockdown that got lifted either maybe prematurely, for a lack of a better term that I'm using, or maybe at the right time but the consequences have been disastrous again. So it'll have to be all the stakeholders meeting at some kind of a halfway measure so that everybody's interest is looked after. The health interest of the common man are also preserved in the same way as is the livelihood of the
Right.
same person.
Given the current situation, Dr. Pandit, do you see 15 June as a possibility for easing of some restrictions, 15th or 21st June, as Mr. Hiranandani was also mentioning? Do you think that there will be a case to ease up some restrictions by then?
Definitely, every day we've been actually improving for the last week or so at least. So I believe that in another 10 days or so, have even better numbers to look at and even probably more freer beds to sort of look at. So definitely this would be discussed. I'm sure the Honorable Chief Minister is going to discuss this and give it a good thought. But I think we need to wait and see. It definitely is something which I'm sure everybody wants. I'm not denying the fact what has been talked about today, but we have to just wait to see what happens closer to the 15th. The current, what we know is that till the current level of restrictions are going on till 15. I have not heard that it's going to be lifted before or after that or whatever levels are there. But definitely this is something which the Honorable Chief Minister would consider and would give a good thought, and then they would probably come out with a plan whether to extend it further or to start unlocking it in a calibrated way or in a gradual fashion. So it will probably be slow. That much I feel it is definitely going to happen. It's not going to happen a very quick unlocking.
Time to go. Mr. Hiranandani, do you think that we need to then up the kind of support that, daily wage workers require, that small businesses require, if we are going to have extended restrictions, especially in certain sectors, your hospitality, tourism, your service sectors? How are they going to survive, say, another 4 to 6 months of uncertainty?
Tamanna, it's a really, really sad story. And Dr. Om Srivastava also flagged off the same concern at the back when he stated that, the daily wage earners, the people who are on the street, who are not getting a single pie today, are in a dire situation. I think something needs to be done if this extension of the lockdown continues. I think some serious measures to see that the poorest of the poor, the bottom of the pyramid, is really taken care of. At least the food element, which is hugely surplus in our godowns, could be doled out much easier right as a starting point to all these people. Now you have a system by which you can do direct money transfers. You have ration shops where they are able to get the food. I think if we are going to continue the way we are, and if it does continue for a longer period of time, I think we really need to do it for that. You can't give them jobs because there are so many millions of people who have gone out of jobs. But at least the social security, food security could be ensured to the lowest on the pyramid, and I think it's important. But the sectoral balance is going to be very difficult to bring back if you're going to lock down for a very, very longer period of time than it is already locked down today. Hence, what Dr. Om Srivastava also hinted at about the calibrated opening that we need to do, we will have to do. We really don't have a choice. I wish I could have said the lockdown for next 6 months more because it is there. You and I will be having food to eat. But there are millions of people who won't have even food to eat. And it's really a sad story that this bottom end of the pyramid is not being yet taken care of. We need to push something to reach them immediately. There are also MSMEs, small enterprises which are out of jobs. Those who are servicing media segment, those who are serving hospitality, those who are servicing various segments of society which are shut, the small shops, services to them, travel, tourism, all these people are grossly affected. So while I am happy to note that many of the sectors of society are doing well, we really need to do it. That's why calibrated opening and taking care of it, as has been mentioned by my other respected panel members.
Okay, so maybe a storm in a teacup today with this snap announcement by one of the Maharashtra ministers that they are going to be opening up, but clearly a matter of caution coming in. Will it be June 15th? Will it be June 21st? Will it be the end of the month? We'll have to wait and see. But the plans to unlock are beginning now to be discussed. Thank you so much to all of you for joining us on the first discussion this evening.